Hello, my name is Carol Brown. I'm an Excelsior College student nurse. I'll be giving IV solution today. First thing we want to do is check the MAR. First of all, the patient's name is Millie Larson, date of birth 1/1/1936. She has no known drug allergies, and the doctor ordered 500 milligrams of 0.19% solution normal saline at 125 milliliters per hour, and the drop factor is 10 drops per milliliter. And I did calculate this out. So the bag is 500 milliliters, and that's times 10 drop factor over the amount of minutes that it's going to take to run the 500, which is 240 minutes. So that equates to 500 over 240, which equals 20.83. So we're going to do 21 drops per minute. So I'm going to gather my supplies. Got IV solution, the tubing, alcohol swab, gloves, antiseptic wipe. All right, we're going to go into the room and introduce us to the patient. Hello, Millie. What is your full name? Millie Anderson. What is your date of birth? 1/1/1936. And let me check your armband. Millie Larson, 1/1/1936. Okay, I'm going to perform hand hygiene. I'm going to give you some IV fluid. The doctor ordered that you need some fluid. So we're going to put that in your IV and run it over 4 hours. Okay, let's get this stuff ready. All right. And my gloves. Itch. And the IV tubing. Okay, we're going to take off the end. The IV tubing, I'm going to close the clamp, make sure nothing drips out while I'm placing this. Take off the tip. I put this in here. I'm going to hang it up here on the IV pole. Squeeze about half. Get fluid about halfway in the chamber. Okay, open this up. And it is clamped. I'm going to put my gloves on. And we're going to use this as the IV site and tubing. So what I'm going to do is I'm going to check, palpate the area, make sure there's no redness, no infiltration, no pain. Next thing I'm going to do is I'm going to prime this. So we're going to take that off, unclamp this and then let it flow. Okay. It's primed. I'm going to check for any air in the tubing. It looks like everything flowed pretty good. There's no air. So next thing I'm going to do is take an alcohol swab. See if you can see that. I'm going to clean the end of the IV tubing, or the IV site. And then I'm going to unhook this. We're going to attach the fluid. And then, per my calculations, 20 drops per minute. So I do have my watch. So I'm going to watch up there. 1, 2, 3, 4, 5, 6, 7, 8. I think I need to slow that down. 21 drops per minute. 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, 21 in a minute. I'm going to provide privacy while this is done. And let's check, make sure this fluid, yeah, it's 0.9%, 500 milliliters. And the expiration date is September 2022. It's Melly Larson, 1/1/1936. No known drug allergies. And she's getting 500 milliliters of normal saline and 125 milliliters an hour, which I calculated out to be 21 drops per minute. It is running. And I'm going to do hand hygiene. I'm going to check the site one more time, and I'm going to check to make sure everything's going correctly. So we're going to check her site, make sure now that it's actually running. Doesn't look like there's any infiltrate, nothing's warm or red. And I'm looking right here on the site, and it's looking good. All right, and just check to see if it's running okay. It's dropping. It is the 500 milliliters of sodium chloride at 125 per milliliters per hour. All right, I'm going to lower the head of bed, give you the call light, and if you need anything, just push the bell. All right, thank you. Have a nice day. I'm going to take off my gloves. I'm going to come back in a few to check on her again. I'm going to do hand hygiene. And I'm going to chart what I did.